Hello, my name is María Teresa Mayorga Madrid, student of the Faculty of Chemical Sciences at the Benemérita Universidad Autónoma de Puebla, and I present the topic Vine of the Dead and its therapeutic use in the living, Ayahuasca. Ayahuasca is a traditional Amazonian decoction with psychoactive properties prepared by the stem bark of Benemérita FCQ-BUAP vine, shown in Figure 1, that contains beta-carbolines in combination with other plants, usually the leaves of Psychotria viridis, shown in Figure 2, that contains an dimethyltryptamine DMT. The active alkaloids of this decoction with potential therapeutic uses in addiction, depression, and anxiety. However, more than 100 plants can be served as sources of beta-carbolines and DMT. As introduction, ayahuasca in the Quechua language means vine of the soul or vine of the dead, and has been empirically used by the Amazonian population in ritual ceremonies for at least 3,000 years. It is consumed orally as an infusion. For this reason, it is necessary an inhibitor of monoamine oxidase MAOI provided from the beta-carbolines of Benemérita FCQ-BUAP to prevent degradation of the DMT by gut and liver MAOs and to lengthen its action within the central nervous system, since even 1 gram of DMT can be metabolized if consumed orally. In Figure 3, I represent the main mechanism of action in which beta-carbolines such as harmine inhibit MAOI, and in addition, THH act as a selective serotonin reuptake inhibitor. Meanwhile, DMT and serotonin compete for the receptors. Hallucinogenic effect of ayahuasca is mediated through the serotonin receptor 5-HT2, of which DMT is an agonist because it is an endoamine. Also, beta-carbolines as harmine and harmaline can be hallucinogenic in sufficient quantities. About its toxicity, the toxic dose is of 7.8 liters for a 75 kilograms person. Also, some animal studies reveal toxicity from in utero ayahuasca exposure. This is not reported in humans, however, is not recommended during pregnancy due to the necessity of serious research. Talking about physical adverse reactions, nausea, vomiting, and diarrhea are relatively common acute physical adverse reactions. Tremor, numbness of the body, paresthesia, and dizziness are associated with harmine after high oral doses. The visual imagery with intense colors is attributed to DMT, also symptoms like mydriasis and tachycardia. Adverse drug reactions. Selective serotonin reuptake inhibitors in combination with ayahuasca may produce serotonin syndrome. Moreover, cases of patients with mental illness such as bipolar disorder present severe psychotic episodes after 48 hours of the ingestion of ayahuasca, and people that consume other substances like anticholinergics, atropine, and scopolamine due to a synergic effect between harmine and this could present hypotensive and hyperthermia reaction and even require mechanical ventilation. So in these cases, the administration of risperidone could help, but sometimes it's necessary administration of haloperidol. Ayahuasca induces dreamlike subjective experiences that may have long-term beneficial effects on psychosocial functioning and well-being. Also, by increasing levels of serotonin and dopamine, and in the other hand, reduce levels of glycine and GABA in amygdala, according to studies in rats. In addition, by its low toxicity, it is suggested for some studies that DMT and beta-carbolines have anti-inflammatory, neuroprotective, and memory-improving effects. Due to these mechanisms, ayahuasca is considered as a potential therapeutic weapon against depression, anxiety, and even some addictions like alcoholism, nicotinism, and cocainism. Thanks for your attention.